One of the main treatments we use is chemotherapy. Many people have heard of chemotherapy and it does create some fear in people, but things have developed significantly and each treatment is tailored to each individual. Chemotherapy aims to control the cancer, to kill the cancer cells, and we use it either as a treatment itself or for people ultimately going on to surgery to shrink the cancer prior to an operation to improve the chances of the operation's success.
Hi, I'm Tracy. I'm one of the chemotherapy nurses that works here in the Macmillan unit. We are only a small team of chemotherapy nurses. There's only about 6 of us, and you will get to meet all the nurses and get to know us all during your time here. When you first come into the chemotherapy unit for treatment, we all understand that it's very daunting and a very frightening experience. You are going into the unknown, and we are aware of that. When you first come in, we'll show you around, show you where the toilets are, and then we'll sit you down and get you a drink, a cup of tea or juice, whatever you like to drink. Once you're comfortable, we'll talk about the chemotherapy and the possible side effects and what to do if you develop any of them side effects. Not everybody gets side effects with chemotherapy. Some people have chemotherapy and they're absolutely fine, but some people do get side effects. And because everybody's so individual, we can't say who will get side effects and who won't. So all we can do is just make you aware of what might happen, and we'll tell you what to do if it does happen. We'll also speak to you about your risk of infection and what to do if you become unwell at home or develop any signs of infection. There's so many different types of chemotherapy, and all chemotherapies take different lengths of time. Some chemotherapies only take about half an hour, where some chemotherapies take all day long, and it depends what type of cancer you've got as to what type of chemotherapy you'll have. So you might see people coming and going, or you might see different people each time you come. But our aim is to make your stay as comfortable and as pleasant as possibly can be.
Chemotherapy clearly is strong treatment and inevitably there are some side effects. The team, including the nurses and the doctors, have become experts in trying to minimize these and tailor treatment for each individual so that they get the maximum gain from the chemotherapy with the minimum side effects. And where side effects occur, then there are a number of measures to try and minimize and control these so that they can be as minimal as possible. We deliver chemotherapy usually in the form of drugs into the vein via a drip, sometimes as a tablet, and one of our colleagues, Dr. Jamil, or one of his colleagues at University Hospital North Midlands, are the experts in delivering this and will explain in greater detail when people have an appointment the risks and benefits of chemotherapy itself. Usually the drugs we use are given in what we call cycles or batches of treatment, so people would have a course of treatment during the day, then recover from the treatment and hopefully gain its benefits over the next few weeks before coming back for a second and sometimes third and often up to 6 what we call cycles of the chemotherapy.